Move toward the tail end of the dog, facing toward the head of the dog. This position will allow you to palpate the hind limbs in a more ergonomic way. Examine the interdigital area for foreign materials or dermatitis. Palpate the digits and look for bony or soft tissue swellings. Flex and extend each individual digit to check for joint pain. Perform long bone palpation of the metatarsal bones. Use a firm, steady compression to help you identify pain or swelling. Feel the tarsus. For normal dogs, due to the presence of an intact calcaneal tendon, the tarsus cannot be flexed with the stifle extended. In dogs with calcaneal tendon rupture, you would be able to flex the tarsal joint with the stifle extended. To perform tarsal flexion, you will have to also flex the stifle joint. Extend the tarsal joint. With the tarsus in extension, check the integrity of collateral ligaments by opening the side of the tarsal joint. Identify the lateral malleolus of the fibula and the medial malleolus of the tibia. Feel the space between the malleoli and the calcaneus. In normal dogs, this space should be concave and flat. In dogs with tarsal joint effusion, the space will be swollen and bulged. Palpate along the tibia shaft. Check for swelling and pain. Note that in normal animal, the only part of the fibula you can palpate exteriorly is fibula head over the lateral cervix. Flex and extend the stifle joint. Check range of motion, crepitus, and pain. Check for stifle instability. With the stifle joint extended, check the medial and lateral collateral ligament integrity by opening up the joint space medially and laterally. Lift the tarsus and lay it on your thigh so the limb is horizontal and parallel to the ground. Grasp the femur with one hand. Place the thumb on the caudal surface of the lateral fibula. Palm proximal to the patella and the rest of the finger over the medial surface of the femur. Use the other hand. Grasp the tibia with index over the proximal aspect of the tibia tuberosity and thumb over the caudal proximal part of the fibula head. Stabilize the femur. Push the tibia forward. Try not to apply rotational force as you may detect normal internal rotation of the tibia, which will be mistaken as a positive test. For cranial drawer test, the force should be directed cranially along the long axis of the tibia. Perform the drawer test in both flexion and extension. This will help detect partial cranial cruciate ligament rupture. In positive cranial drawer test, you can see the tibia sliding cranial in relation to the femur. Now slide your hand on the tibia distally to hold onto the plantar aspect of the tarsus. Stabilize the femur and stifle joint. Apply a proximal force with the hand on the plantar tarsus. The purpose would be to flex the tarsal joint until the calcaneus tendon is tight. Similar to the dog standing, in normal dogs, you should not see any cranial movement of the tibia, since the stifle is stabilized by cranial cruciate ligament. Pay attention not to twist the tibia. Normal stifle has some internal rotation, and you do not want to mistaken that as a positive tibial compression test. In dogs with positive tibia compression test, you can see as you apply a proximal force on the tarsus, the tibia will slide forward. Now keep the hand on the tarsus. Slide your hand around the femur to look for the location of the patella. With the stifle extension, use the thumb and index finger to identify the patella. Push the patella laterally and medially to check for patella luxation. Twist the toe laterally, tarsus medially when you push the patella laterally. And twist the toe medially, tarsus laterally when you push the patella medially. Palpate along the shaft of the femur with firm compression to check for swelling or pain. Palpate the dorsal border of the pelvis. Feel the iliac vein, greater trochanter, and ischium. Iliac vein, greater trochanter, and the ischium. The 3 points should form a triangle with the greater trochanter slightly distal. Deviation of the greater trochanter may be indicative of hip luxation or severe hip dysplasia. Put one hand to support the dorsal pelvis. Wrap the other hand over the cranial lateral border of the femur. Perform extension of the hip joint. If you feel pain response, repeat the extension 2 to 3 times to make sure it's real. Perform flexion of the hip joint and abduction of the hip joint. Extension, flexion, and abduction. In young, slightly sedated dogs with severe hip dysplasia, support dorsal pelvis with one hand. Use the other hand at the level of stifle. Apply a proximal force along the axis of femur and abduct the hip joint to feel for subluxation or reduction of the hip. Always do a rectal examination to evaluate the pelvic canal. We will not do this in our dogs. Finally, gently pinch the toes to elicit withdrawal reflex. Observe flexion activity of the tarsal, stifle, and hip joint.